Hello everyone, you are all welcome to lecture number 1201, and today's topic is dietary treatment of high blood pressure, or we can say dietary approach to lower the high blood pressure. Recently, there are a lot of publications, especially from Harvard Medical School and from British School of Medicine, and they have mentioned that plant-based diet, which are rich in potassium, magnesium and calcium, are capable of maintaining the blood pressure while you are reducing your weight, and also reducing intake of junk food, fat, refined food, and shift to whole grain, seed, nut. Once you go to any doctor, and if you have the blood pressure, high blood pressure, or tendency of high blood pressure, the first thing doctor will tell you that strictly reduce the intake of table salt, that is called sodium chloride. Secondly, reduce obesity or your weight, and then after that he will prescribe some medicine, and mostly these medicines are nothing but diuretic medicines. Drugs means those medicines will allow to flush out some water or liquid from your body. That is the treatment. But this research, what they have done, it has got very interesting finding that I am going to discuss here. First thing is that they have mentioned that some factors are responsible of constricting and making your blood vessels wall rigid and hard and losing the elasticity. So for these factors, they have mentioned that actually hormones are responsible. And that is very interesting part of the research paper. We are having the impression that once the intake of salt is restricted, means drastically reduced. They disagree with that. They mention in paper that once you are reducing intake of sodium chloride salt, to have this impression that if sodium ion is reduced, means water retention in the body will be very much reduced. But at the same time, there are some medicinal chemistries, some reactions are involved, and they are playing very important role according to their research publications. They have mentioned in the paper that if you are reducing drastically intake of sodium chloride, it will activate your adrenal gland, and once your adrenal gland is activated, it will produce more and more aldosterone hormone, and that aldosterone hormone, if more is produced, and at the same time angiotensin hormone is also produced, for that kidney is responsible, and these two hormones are produced in large amount, in excess quantity, is going to make your blood vessels constricted and hard. This is very latest and very interesting research finding. So up to certain limiting of salt, they mention that it is not going to play very important role of restricting the salt, because the mercury level will be maybe down or adjusted, maybe some 1 to mercury level. And if we are maintaining proper herbal of plant diet that is more effective in your lifestyle. According to their paper, the first condition, your mental, that is responsible also of your hypertension. Mental means stress. And stress is playing very important role again to make your body sensitive towards lot of molecules, towards even salt, towards hormone, towards insulin. It is also discussed that in your body, if you are obese, some insulins are retained, and those insulins are responsible of maintaining sugar in your body. But if the level of insulin, that I call insulin bad hormone, because that bad hormone will allow your body to retain more and more fat. And if the amount of insulin is more in your body, again it is sensitive to salt, sodium chloride, and the retention of salt will be more in presence of insulin. So insulin is another hormone playing important role. Aldosterone, adrenaline, ghrelin, and then angiotensin that is produced by kidney, they are playing very important role to maintain the high blood pressure. And that's why they call it that if you go for DASH diet, they call it DASH. DASH, DASH diet. DASH diet means a dietary approach to stop hypertension. That is, they call it DASH diet. And what is their DASH diet? They have mentions of serving amount that I will give you later on. But of course, all those are mainly vegetable and fruits. For example, pumpkin, we call it kaddu in Indian language. It's a rich source of magnesium, potassium. Banana is the rich source of magnesium and potassium. Spinach, cabbage, they are the source of calcium, magnesium. So like that, I have mentioned here, you selectively take those vegetables, maintain your weight, and according to research paper, is not that I am saying, don't reduce too much intake of salt. Rather than to improve your health condition, it may deteriorate because your hormones will be disturbed. And hormones, these three hormones, what I have mentioned, are playing very important role in constricting of your blood vessel and also the keeping lot of obesity. For that also hormones are responsible. So these are all main factors. So I have written all those factors what I have told you. First, obesity causes salt to be retained. That's why doctors will say immediately, first, if you are obese, maintain your weight, reduce your weight, because that one, obesity means there is some insulin in the bloodstream, it is already there, and if insulin is little bit more in the body, it will retain the salt. Number two, insulin level causes salt to be retained. Number three, eating refined foods makes your body much sensitive to salt. So why they are saying that you should not go for refined product like white flour, we call it maida, and the refined sugar. So many other junk food, they are all mostly refined. These refined products, they are also sensitive to salt, and salt will be more retained. If we are going for whole grain, your 80% food should be whole grain. Whole grain contains a lot of fiber and a lot of other protein and carbohydrate, and that will not allow salt to be retained, so that there will be chance of blood pressure. And then Number 4, which I have already told you, much restriction of salt makes adrenal gland much active to produce large amount of aldosterone hormone, and this aldosterone hormone is going to make your blood vessel more constricted, and its elasticity will be lost, or it will be hard. Number 5, kidney produces hormone that will be also increased if you are restricting too much the salt, that is called angiotensin. So the angiotensin hormone, I am discussing whole what I have written is the summary of the research publications, the latest one, and this summary is from Harvard School of Medicine, USA, what they have mentioned in there. So this hormone is also responsible, that is angiotensin is released, and that is from kidney. That's why blood pressure is very much related to your kidney condition. It's very important. And then number 6, add in your diet potassium, magnesium, calcium minerals, and potassium rich vegetables, fruits are spinach, banana, pumpkin, cucumber, eggplants. Eggplant is bagan. Magnesium rich foods are spinach, green leafy vegetable, tofu, banana, seeds, and nut. Nut means badam, akhrot, kaju, they are called dry fruit, and in common name they are called as nut. Calcium, broccoli, almond means badam, bean, figs means anjeer. Nowadays in most of the stores, dehydrated figs are available, and main production of fig is from Afghanistan. So some 40-50 years ago it was not available like that, but now technology is very advanced. Lot of dehydrated fruits and vegetables are available, so that is available. It's also very good source of calcium. Okra means bindi, lady's finger, and cabbage. So in the research publication, the size is mentioned, and the same I have given here. First, they have mentioned that reduce your calorie to 1600 per day, and serving sizes are as follows. Typically, first 8 servings of whole grains, and 1 serving they have mentioned amount to half cup anything which is cooked. Then number 2, 5 servings of vegetables, 5 servings of fruits, 3 servings of low fat milk. In India we call it skim milk, yogurt or cheese. Number 5, 5 servings per week of nuts, seeds and beans. Nuts means almond or cashew or walnut, and nowadays seeds are also available like pumpkin seed and some other watermelon seeds, and beans are also there. Number 6, 2 servings of fish, lean meat. Lean meat means breast of the chicken, and no sugar, no bad trans fat. Means as much as possible you reduce intake of sugar, and bad fat means trans fat, the one which is solid at room temperature. Note, serving sizes are actually half cup of cooked food, then 1 cup of fruits or vegetables, that is raw, and 2 tablespoons of nuts or seeds. That is the meaning of sizes. And the author suggested, I suggest DASH diet. DASH means dietary approach to stop hypertension. That diet they are nowadays commonly, they call it DASH diet. So DASH diet is good for your heart health because it will drastically reduce the cholesterol, and also it will maintain your sugar level. So it is good for diabetic condition, and of course I am discussing already the high blood pressure. So your DASH diet is bringing 3 health benefit to you if you are following. First, your high blood pressure will be normal. Second, your diabetic condition will be normal, and your cardiovascular system, heart will be healthy. Let me show. So here a very clear picture is given that how these hormones, that is aldosterone produced by adrenal gland and angiotensin is produced by kidney, is going to constrict your blood vessel, and by constriction the space is reduced for the blood to flow, RBC and other material, and in this way you will get blood pressure. You can see here how if the water or fluid is retained because of sodium or sodium chloride salt, it will reduce the space of the blood to flow, and because of that reason you will get high blood pressure, and that's why diuretic medicine is given by doctor, that is synthetic. But this condition can be controlled if you are on DASH diet. So with this I will stop and follow DASH diet, because in the research paper they mentioned that the people who were kept on DASH diet at least for 2 to 3 weeks, and then their high blood pressure was maintained. So you regularly add these diets and avoid, if it is possible, the synthetic drugs as much as possible. There are nowadays in Western countries, many of them, they are following this DASH diet, and at the same time, as much as possible, reduce your mental tension. Stop chasing lot of material values. Once you have lost your health, everything is lost. With this I will stop. Thank you very much for watching the lecture.